beginning, one of the things that sort of upsets oncologists is that there is no evidence or no data from which to make recommendations about nutrition and cancer, but that's not actually true. The American Cancer Society actually every 5 years publishes in their journal an update on nutrition and physical activity in cancer. And the American Institute for Cancer Research, World Cancer Research Fund, puts out a 700-page volume every 10 years. And it was 2007 was the last one, and then they just did an update in 2018. And so what I want to do is tell you a little bit, review what the difference between those two reports are. Now again, this is what I mentioned. This is from the State of the U.S. Health, the burden of disease. And the #1 risk factor for mortality is dietary risks, followed by tobacco use, high blood pressure, and then high body mass index, and down here, low physical activity. So really, those lifestyle features are critical causes of morbidity and mortality in the United States. So to figure out what they mean by low or by dietary risks, I had to go to a Lancet article which tells us that the 14 components of what they call dietary risk are diets that are low in fruits, vegetables, whole grains, nuts and seeds, milk, fiber, calcium, seafood omega-3 fatty acids, and polyunsaturated fatty acids, and diets that are high in red meat, processed meats, sugar-sweetened beverages, trans fats, and sodium. So again, this is the 2007 cover of the American Institute for Cancer Research, and that's the 2018 cover. And this is basically their schematic of their recommendations, and I saw that AICR has a booth here, and I urge you to go look at that. But I'm going to review all of these guidelines, which are essentially guidelines for reducing the risk of cancer. But number 10 says, for cancer survivors, follow the 9 guidelines above. So they changed the wording a little bit between 07 and 18, and for the most part, except for one exception, I'm not particularly happy about their wording change. Well, this one maybe is a little, be as lean as possible without becoming underweight. So body mass index is normally 18.5 to 24.9, that's normal. 25 to 30 is overweight, and over 30 is obese. So being as lean as possible without becoming underweight might be a little too thin, especially now we recognize that some cancer survivors do better with a little bit more weight. Now they say be a healthy weight, keep your weight within the healthy range, and avoid weight gain in adult life. So I think that is probably a better wording. Now, unfortunately, we as a nation are not doing a very good job of keeping a healthy weight. Currently, 1/3 of adults in the United States are overweight, and another 1/3 are obese. So only 1/3 of Americans are a normal, healthy weight. And this shows you that Colorado is always the last state to go as far as tipping over into the bad zone. It's unfortunate. The Centers for Disease Control now estimates that overweight or obesity is associated with 40% of all cancer in the United States. 55% of all cancer in women, and 1/4 of all cancer in men. 2/3 of all cancer in people 50 to 74. More than 630,000 Americans are diagnosed with an overweight or obesity-associated cancer. Now, interestingly, this is what the CDC estimates, and the American Cancer Society put out an article recently that said 9% of cancer in the United States is associated with obesity. And so I sent an email to the lead author, and I said, wait a minute, you're right down the street from the CDC, and they say 40%. And they told me, what they responded back was that CDC estimates that 40% of cancer that are related to obesity are caused by obesity, and they're estimating that 9% of all cancer in the United States is related to obesity. The American Institute for Cancer Research estimated that obesity-related excesses of these 7 cancers account for 115,000 preventable deaths in the United States each year. So the largest N is breast. Only 20% of breast cancer is related to overweight or obesity. That's generally post-menopausal estrogen receptor positive breast cancer. But because so many women have it, it's the largest total number. 50% of endometrial cancer is related to overweight or obesity. The rest of the cancers associated with overweight or obesity are pretty much along the gastrointestinal tract, except 1 in 4 cases of kidney cancer, interestingly, is related to overweight or obesity. This year they added some other cancers that are probably at increased risk for people that are overweight or obese: the mouth, pharynx, and larynx, ovary, and prostate, suggestive increased risk for cervix, and actually being overweight decreases the risk of premenopausal breast cancer. So how does that work? Why does being overweight put you at greater risk for cancer? Number one, for those cancers that are fueled by hormones, fat makes estrogen. So for the breast cancer, estrogen receptor positive; for the endometrial cancer, that's a problem. So women who have those diagnoses, I really try to get really convinced that it's best for them if they lose some body fat. Fat also secretes chemicals that promote inflammation. And when you have ongoing inflammation, your immune system is sort of busy taking care of that and can't turn to fight against cancer. And you know now, many of our treatments are trying to boost the body's own immune system to fight off cancer. So bullets 2 and 3 are really quite related. I think probably the most important thing is that people with too much body fat become insulin resistant. So the body needs to produce more insulin and more insulin-like growth factor. Both of these promote inflammation, which again we're trying to decrease. And the insulin-like growth factor is a growth factor for cancer cells as well, to the point where we're now looking at blocking insulin-like growth factor 1 receptor as a treatment for a number of cancers. So that, I think, is pretty important. And this just shows you insulin-like growth factor 1, insulin-like growth factor. When they complex with the receptor on the cell surface, they lead to changes in increased protein synthesis that leads to increased cell division and decreased programmed cell death. So insulin, insulin-like growth factor are a problem. The guideline number 2 says be physically active for at least 30 minutes every day. The new guideline is a little bit changed, less specific: be physically active as part of everyday life, walk more and sit less. Again, I sort of like the old one better because it gives you a little bit of a prescription, 30 minutes each day, and maybe that's how you gain your $25,000 of happiness. Now, we know in people that physical activity actually decreases the risk of a number of cancers: breast, colon, prostate. And we know that in patients with those same cancers, patients who are physically active also have decreased death from both their cancers and other causes. Survivors report an increase in activity after diagnosis, had a lower risk of death, 40% lower than those who did not. So again, it's not too late after your cancer diagnosis to increase your physical activity and get a benefit from it. Interestingly, most cancer patients would like their oncologist to tell them to increase their physical activity. Most oncologists believe it's important to do so, but only 25% ever talk about it. I like the old guideline better: avoid sugary drinks. And then it said underneath it, limit consumption of energy-dense foods, particularly processed foods high in added sugar or low in fiber or high in fat. Now the guideline was split into 2 separate components in the 2018 edition. I was in Bethesda in 2007 when they put the new guideline as avoid sugary drinks. And I went to the microphone and asked the question. I said, there are sugary drinks and there are sugary drinks. You can drink a cola beverage, God forbid, or a fruit punch, which is probably glucose and high fructose corn syrup, or you could squeeze 3 oranges in the morning. And the response from the podium was, energetically, they're all the same. So I had lunch with Robert Lustig, who's our pediatric endocrinologist, who fights the war on childhood obesity and the war on sugar. And he told me, if you eat an orange, the fiber slows down the absorption of sugar into the bloodstream. But if you squeeze the sugar away from the fiber, it's like drinking a Coca-Cola. So why is that bad? When the body sees that sugar, it responds with insulin and insulin-like growth factor, both of which promote inflammation, and the growth factor is a growth factor for cancer cells as well, as I just said. So does it mean I don't squeeze my 3 oranges? I used to do it every day. Now I just do it twice a week. But sugar is the #1 no. And when my colleagues at the Cancer Center say, Donald, why do you tell all of our patients that cancer loves sugar? I say, what's a PET scan? How many of you have had a PET scan? Yeah, what do they inject you with? Sugar. And where does it go? To the cancer, because cancer needs sugar, it doesn't use oxygen. So that's why I'm a little bit concerned about my patients who want to juice everything, particularly if it's fruit. And everybody says, well, what about smoothies? I don't know. Everybody says that there's still fiber in their smoothies. I don't know. Not every day, not every meal. Every once in a while. So the new guideline now says limit consumption of fast foods and other processed foods high in fat, starches, or sugar. And unfortunately, this is what a lot of America lives on. And we talked about food insecurity. Well, my organic apple that I eat every day for lunch costs as much as a double cheeseburger, fries, and a milkshake. And that's unfortunate that our government subsidizes the wrong kind of food. Processed foods high in fat, starches, or sugars embody a cluster of characteristics that encourage excess energy consumption. For example, by being highly palatable, high in energy, affordable, easy to access, and convenient to store. So think about that when you shop. Now, there was a study that, is there any evidence that eating processed foods is bad? This was just published last year, and they did this, they gave scores to the foods. Higher score associated with a higher risk for cancer. And these were scores, again, about how processed the food was. Higher scores were associated with higher risk of colorectal cancer, hepatocellular carcinoma, and postmenopausal breast cancer in women, and lung and a borderline increase in prostate cancer in men. Also, a higher risk of stomach and upper aerodigestive tract cancers were also observed. So there is becoming evidence now that heavily processed foods are not good for us. So guideline number 3, again, as I said, was avoid sugary drinks, and you can see why I don't like the new guideline. Limit consumption of sugar-sweetened drinks. Well, orange juice per se is not sugar-sweetened. It's a sugary drink. So I think sugary drinks is better. But this brings up an interesting point. I just threw away my wrapper from my organic bar that I just ate. When I say no sugar, it's okay to have sugars in the nutrition facts box when you buy something with a label. Where I don't want to see sugar or any nickname for sugar is in the ingredients list. So I demonstrate a bar to my patients that has 13 grams of sugar in the nutrition facts box, and the first ingredient is brown rice syrup, which sounds like sugar, followed by soy protein isolate, evaporated cane juice crystals, and then crystalline fructose. And then there's 4 more lines of ingredients. And then I show them my organic bar that I eat that has 15 grams of sugar. I don't worry about sugar in the nutrition facts box. The ingredients, cashews, dates. Got it? So I talked about oranges, and again, sugar, so blue is refined sugar, black is high fructose corn syrup, and gray is other corn sweeteners. And you can see that for a while, we sort of decreased our intake of sugar and replaced it with high fructose corn syrup until we became concerned about the health risks of high fructose corn syrup. But on average, Americans consume 125 pounds a year of sugar and sugar-related. And in the 1800s, it was 5 pounds. I don't know if anybody's watched That Sugar film. It's about an Australian, it sort of supersized me for sugar. It's about an Australian guy who doesn't eat sugar, but the average Australian eats 40 teaspoons of sugar a day, the equivalent of. So under a doctor's supervision, he tries to eat healthy food that contains the equivalent of 40 teaspoons of sugar a day, and over 6 weeks, he gains weight, his waist increases, and his liver becomes fatty in 6 weeks. How can anyone consume that much sugar? Well, many of us were brought up in this generation where our mothers were told that these sugar-sweetened beverages were good for children. And it's not a surprise then that the most evolved creature here is carrying a big slurp, or whatever you call it. And again, so men with prostate cancer are told to drink 8 ounces of pomegranate juice a day. No. Take a pomegranate supplement. Don't drink 8 ounces of any juice a day. My patients wonder if these juices are going to cure their cancer. I say eat blueberries. These are all just potent antioxidants. You should eat the fruit and not shop for these fancy juices. And again, what's a PET scan? So there you have it. Eat more variety of vegetables, fruits, whole grains, and legumes, such as beans. Pretty much unchanged, moved from guideline number 4 now to guideline number 3. Unfortunately, we don't do that. We now tell people to eat about 4.5 cups of fruits and vegetables each day, more vegetables than fruits. And you can see only 12% of adults eat 1.5 to 2 cup equivalents of fruit a day, 9% eat 2 to 3 cup equivalents of vegetables, and for youth, the numbers are even lower, and that counts French fries and ketchup as 2 vegetables. Yeah. So my recommendations for people are to eat more plant estrogens, soy foods. I know a lot of the women I see with estrogen receptor positive breast cancer are concerned about eating soy because it is a plant estrogen. Studies, including studies done at Kaiser, have shown that 1 portion of a whole soy food a day decreases the risk of breast cancer and decreases the risk of recurrence. And that study was reproduced in Shanghai as well. So it's a whole soy food, soybean, soy milk, tofu, tempeh, or miso, and not soy cheese, soy turkey, or soy hot dogs. Because those are just heavily processed soy foods. Cruciferous vegetables, flowers grow in the shape of a crucifix, should be your best friend. So broccoli, cauliflower, and Brussels sprouts jump to mind, but there are also cruciferous roots and green leafies, cabbage, kale, collard green, bok choy, arugula. These contain a chemical so potent at reducing the risk of cancer that we started to look at it as a treatment for prostate cancer. They also contain a chemical that changes estrogen from the type that fuels estrogen receptor positive cancer to the type that doesn't. So I don't believe we can ever eat enough cruciferous vegetables, and I eat broccoli, tofu, and rice for breakfast. My other breakfast is mochi, which is just pounded brown rice. I puff it up in the oven, smear almond butter, and put a sweet potato on top of it because orange yellow vegetables are also good for you. Season with ginger, garlic, onions, and turmeric. Turmeric, India, huge country, very low rates of both dementia and heart disease. In trying to hone down on why that is, people have sort of focused on turmeric, the spice that gives curry its characteristic yellow color, but does not really impart much flavor. The flavor in a curry is from the cumin, fenugreek, and coriander. The turmeric is just like a stain that makes it yellow, but appears to be particularly good for protection against gastrointestinal malignancies. And then green tea, second only to cruciferous vegetables in its cancer-fighting activity. Tea is the name of the beverage brewed from the Chinese camellia, or the Camellia sinensis, and it's graded on how oxidized the leaf is before the beverage is brewed. White, green, oolong, black, and pu'er. And the only 2 that have the active cancer-fighting polyphenol are the white and green. So green tea should be good. So this is one of the problems that we have with research in nutrition and cancer. Again, we can't do a randomized placebo-controlled trial. So we have to depend on epidemiologic studies, looking at a large population, trying to understand what they eat, and following them over the years to see what happens. So this is a study of 200,000 men and women in Hawaii and California that were followed for 7 years for the development of colorectal cancer. And they filled out detailed questionnaires on their dietary habits. And over the 7 years, 2,000 out of the 200,000 developed colorectal cancer. For men, higher levels of fruit and vegetable intake was associated with a 25% decreased risk of colon cancer. However, for women, there was no risk reduction. So why should fruit and vegetables work for men and not for women? That doesn't make sense. And then this study also concluded that intake of grains had no effect in either sex, whereas we know that high grain, high fiber decreases the risk of colon cancer. So this is why my oncology colleagues say, oi, we don't know what to make of this. Limit consumption of red meat, beef, pork, and lamb, and avoid processed meats. And I'm not happy with the new one. Limit consumption of red and processed meats. I think the processed meats company, I don't know if they could influence the people that make these guidelines, because meat is really a no. This is a graph showing per capita daily meat consumption in grams and the risk of developing colon cancer in women. This is an old graph, so that New Zealand and the United States have now been replaced by the Czech Republic and Japan because of globalization of the standard American diet. And in Europe, processed meats are known to be a class 1 carcinogen. And that's why it used to say limit consumption of red meat and avoid processed meats, and now it just says limit consumption of red and processed meats. Processed meats, bacon, salami, bologna, hot dogs, sausage, anything you put on a pizza. It's what we serve our interns and residents at the hospital every day. It's almost as bad as Chick-fil-A. Personally, the only red meat that I'll eat is lamb, because beef and pork I never picture as being clean the way we raise them, and lamb I picture on the hills of Sonoma or New Zealand. And I only eat lamb maybe once a week or 3 times a month. I'm pretty much vegan until dinner time, and that's when I eat my animals. Not my dogs. And so this is a slide from David Servan-Schreiber, who was French and hence he spelled pork differently. But he's showing us the transformation of our food chain with regards to the levels of the omega-6 fatty acids to the levels of omega-3 fatty acids. When you cut yourself, you want your platelets to clump, and you want to get red, hot, tender, and swollen. That's inflammation, because that's part of normal wound healing. That's what omega-6 fatty acids promote. Omega-3 fatty acids, on the other hand, promote platelet clot dissolution and anti-inflammatory. So our diet in the old days used to have a ratio of omega-6 to omega-3 of 2 to 1, and now for some foods it's actually 20 to 1. Our overall diet in America is now 18 to 1 omega-6 to omega-3. The most inflammation-promoting foods out there are poultry and eggs. Not only because of what we feed them, so they make fat rich in omega-6 fatty acids, but they themselves are a rich source of arachidonic acid, the precursor to prostaglandins, the chemical mediators of inflammation. So poultry, which I eat, should be organic. Eggs, the average American eats 300 eggs a year. I eat 1 at Passover when we dip them in salt water because they give me terrible gas. And they are associated with prostate cancer. So eggs, and because they should be organic omega-3 eggs if you eat eggs. So meat, it's not just the omega-6 fatty acids that make meat a problem. Meat is very rich in iron. Many of my cancer patients become anemic and they start taking iron. Iron feeds cancer. If you're not anemic from iron deficiency, iron is not a good thing. And that's one of the problems with red meat. Processed meats are rich in nitrates, and they are positively associated with the development, particularly of colorectal cancer. And then unfortunately, because it's summer and we live in this society, we love to barbecue. So we burn flesh. Burnt flesh produces heterocyclic amines, which are also positively associated with colon cancer. I'll have a half-pound double deluxe bacon steer burger, please. You want chemotherapy with that? Now, in 2007, the guideline said, if consumed at all, limit alcohol to 2 a day for men and 1 a day for women. If at all, 2 a day? That seemed really hard for me to rationalize to patients. Especially, I reached an age a few years ago where I do not metabolize alcohol. So I am unable to drink it. And when I go to an event with friends or go out to a restaurant, if you don't drink alcohol, my brother's a diesel mechanic in Detroit, and he said, Donald, if you don't drink alcohol, people think you're a recovering alcoholic. And it is amazing how mainstreamed alcohol is in our society compared to cannabis, for example, which is becoming more mainstream, which is so much more healthier than alcohol. So the new guideline says for cancer prevention, it is best not to drink alcohol. 0. And alcohol increases the risk of all of these cancers. The burden of disease report from the Gates Foundation found that about 6% of cancer death around the world is related, or death around the world is from alcohol. And in young people, it's accidents and suicides. And in people over 50, the burden of disease is from the development of these cancers. Now, interestingly, alcohol possibly decreases the risk of kidney cancer, but I don't think that's a good enough reason to drink alcohol. Again, this is what I said, alcohol use was the 7th leading risk factor for death. For those over 50, cancer accounted for the largest proportion of alcohol deaths. Now, I mentioned salt, that there was some article now that said salt sort of improves the immune system so it fights cancer cells, but I don't think that that's a good enough reason to consume salty foods, because we know that in Asia, the most common cancers are of the esophagus and stomach, and it's felt that that's related to pickling and salt preservation of meats. So that was the 2007 recommendation that was deleted to make room for the split of guidelines number 3 to guideline number 4 and 6, the sugary drinks splitting from the heavily processed food. So one question that I'm sure you're all asking, does it really make a difference after you have a diagnosis of cancer? So studies showed that patients who adhere to these these are the American Cancer Society guidelines, had, again, about a 40% reduction in death. And when they added the alcohol component, it's a 50% reduction in death if you adhere to the guidelines as recommended. And this is another study that was done in patients with colorectal cancer who received adjuvant chemotherapy. And it looked at those who had what was called a low quintile of the standard American diet compared to those who had the most advanced standard American diet, high in refined carbohydrates, saturated fats, and red meat. And these people with the lowest were the reference group, and those people who ate the most American diet had a 3-fold risk of recurrence of their colon cancer and a 2-fold increased risk of death compared to people who ate a healthier diet. And again, in a recent analysis of that same data, they found that it was actually insulin, as I mentioned a few times, that increased this whole risk of dying faster, the glycemic load, and the higher dietary insulin load associated with worse disease-free survival and higher levels in women who were less physically active, ate cereals and total carbohydrates and less alcohol. So one of the things that, of course, we're all very interested in now is this microbiome, the environment of bacteria in our body, particularly in our guts. And it's now felt that you have to have a special microbiome to be responsive to the new immunotherapies. And this is a study undergoing that looked at stool fecal samples from 146 melanoma patients who were beginning immunotherapy, and they also collected baseline dietary information. And what they found was that whole grains and overall diet quality correlated positively with bacteria that led to a good response, particularly high fiber, and added sugars and processed meats correlated negatively with responses to immunotherapy. Similarly, taking a probiotic also was associated, a probiotic pill was associated with less response to immunotherapy. So it's all very interesting how the diet impacts bacteria in our colon, and it all harkens back to Hippocrates, who was the first to tell us that we should let food be our medicine and medicine be our food. And with that, I'll stop this presentation.
I was told like the time's up. So
Oh, okay.
no time for
Thank you very
questions.
much.
But we're going to have 2 more lectures.
We want to have